Hi, I'm Walid Afifi. I'm a professor in the Department of Communication at the University of California, Santa Barbara, director of the Center for Middle East Studies there. And my area of research is on uncertainty and its effects on individuals and how they manage it. I'm really honored by the invitation by CARE on this COVID lecture series to talk to you a little bit about uncertainty, about some of what we know about uncertainty, about some of the research that we've done on uncertainty and its impact, and how we can manage uncertainty, and really where we need to go from here, both in terms of research and most importantly, in terms of community work tied to that research. So here we go. I'm going to kind of give you a little bit of an overview. So first of all, we're going to talk a little about what is uncertainty. Multiple disciplines have studied it. There's lots of different perspectives on it, and so I'm going to break this sort of overall lecture into 4 parts. First of all, just a little bit about what it is and what it's not. We're then going to go into a study that we just completed on COVID in the United States and the experiences of uncertainty and their impacts. This is really preliminary data. We're just now starting to analyze those data, but I wanted to give you at least a little sneak peek about what some of the things are that we're finding. Then I'm going to go into a little bit about how to manage uncertainty. I've been working on a 4-part sort of model on how to think about how we can best manage uncertainty. And this is actually the first time that I'm presenting it publicly, and so I'm excited to share that with you, although it's based on decades of work from myself, but more importantly from lots of other folks. And ultimately, just a conclusion, a little wrap up about what it is that we can do from here, where we should go from here, and ways in which we can do better, both in terms of research and in terms of community. So here we go. I sort of trying to do about 15 minutes per segment, so we get a little bit of some shifts from there and there. So here we go. We'll start with a little bit about what is uncertainty. So if you do a search on uncertainty, this is all images from a Google search, and these are some examples of what you'll find. And on the top row, you'll see a lot of images about confusion, right? So on the far left, you'll see the person who's not, there's many different ways to go, and she doesn't know where to go. In the middle, the person just has so many things going on, they're really confused. If you're confused, of course, the COVID example on the far top right, where there's just questions, right? So there's one version of what we think about when we think about uncertainty, if we're looking at what Google tells us, at least. On the bottom, there's links to anxiety. They're sort of filled with, on the bottom left, if you can see that, it's someone looking up at this huge wave. Within the wave are all kinds of different things, but like a house and environmental issues and health and the earth and et cetera, right? So just a lot of sort of a wave of fears, it looks like, that are crashing down on, it looks like a male figure there. In the middle, it's from a documentary on anxiety and the link of uncertainty with generalized anxiety disorder, which we'll talk about in a little bit. And on the right again is the COVID example. Not only is this question right now, but in the top, but in this version, the virus is running down a hill after an individual. So again, there's the sort of fear, anxiety component of uncertainty. And this actually reflects pretty well what we think about and what the literature says when we think about uncertainty. So even though these were just from Google images, they actually capture it really well. So what is the definition that we're going to use? So Penrod in 2001, there have been many chapters and articles and scholars who have defined uncertainty. In fact, every discipline studies uncertainty in some way or another, and being an expert on uncertainty is always humbling, because undoubtedly I'll have missed sometimes significant literatures in a discipline that we don't cite in communication, that even social psychologists, which is my closest cousin discipline, don't cite, public health people don't cite, etc., but that have been studying uncertainty in their own way. So every discipline, every area studies some version of uncertainty, even religious studies. There's a lot of work in religiosity around uncertainty, about religion and about higher beings and about, et cetera. So every area has some discussion of uncertainty. Penrod did some work on uncertainty in the nursing context, in the health context, reviewed lots of work in that area, and came up with this definition, or sort of emerged with this definition. Quote, a dynamic state in which there is a perception of being unable to assign probabilities for outcomes that prompt a discomforting, uneasy sensation. Now, one of the reasons I picked this particular definition, other times I've used different definitions, but this kind of captures some of the key components. First of all, this idea of probabilities, unable to assign probabilities. Now, there's a whole area within risk decision-making that looks at really probabilities and probabilistic decision-making and the link between uncertainty and probabilities, right? So the greatest uncertainty would be a 50-50 chance. The further away from that 50-50 chance, the less your uncertainty of what this outcome might be. And there's a large literature that has looked at that idea and how we respond differently to different probabilities. That's actually not the work that I rely on, because I don't look at the notion of particular specific probabilities. I don't think that we, in the sense of just the day-to-day, certainly we rely on probabilities under certain decisions, et cetera. I'm not denying that literature. It's very well-established literature. Only that the kinds of measurements that I use of uncertainty are more generalized, they're more subjective, and they really ask more about, are you able to predict an outcome? So a perception of being unable to assign probabilities fits that sort of notion of the way I think about uncertainty. For outcomes that prompt a discomforting, uneasy sensation. So this is a really important part about uncertainty that we're going to be focused on in this discussion. But there's, again, a large literature on whether uncertainty is always anxiety producing, always produces discomfort or unease. And we'll get to that shortly. But this sort of captured a good definition for our purposes today. All right, so probably one of the biggest sort of questions I get from folks is, well, isn't this stress? Isn't the same thing as stress? And absolutely, uncertainty and stress are very much connected. In fact, in some definitions of stress, uncertainty is actually part of a definition of what causes stress. And in fact, in some definitions of stress, uncertainty is even part of sort of the basic notion of what stress is. But uncertainty and stress are actually quite conceptually distinct, right? So one of the key criterions for uncertainty is that's the inability to predict important outcomes. In fact, they don't have to necessarily be important. We could think about uncertainty. I wake up uncertain about how my day is going to go, what I'm going to get dressed, whether our dogs are going to be good. We have two dogs. If our two daughters are going to have a good, so some of those are certainly important outcomes, others of them not so much. So my interest tends to be on important outcomes, but we can actually think about uncertainty broadly. We're always working with uncertainty. Every moment is to some degree uncertain in terms of being able to predict the future. But the key is this inability to predict outcomes. On the stress side, the key criterion, and this comes from the general definition, is an appraisal that circumstances exceed our ability to manage it. So it's a sense that we don't have the ability to manage the current, to adequately manage, to our at least comfort, the things that are facing us. Now, sometimes, maybe often, uncertainty is a causal agent for that sense that we can't, or don't feel comfortable ability to manage it, but not always. And in fact, if you go down to the key fact under stress on the bottom right, we know that both certainty and uncertainty could produce stress. So being certain that I'm going to get fired is stress producing, right? I mean, I know I'm going to get fired. I know I have a week left. It's very stress producing. I'm certain that I'm going to, in certain circumstances get infected, under certain circumstances get infected by COVID. That's not going to reduce my stress, right? So we know that certainty can produce stress, and also sometimes uncertainty can produce stress. But just to sort of make the point that it's not that uncertainty by in itself is necessarily by definition tied to stress. Because if both certainty and uncertainty can produce stress, then they're conceptually distinct. And if you look on the other side, the key fact under uncertainty, it's generally stress producing, yes, but not always. In fact, one of my graduate school classmates, Dale Brashears, who passed away unfortunately several years ago, but was a leading figure in studying uncertainty. And his primary contribution was understanding and recognizing that uncertainty sometimes is actually what people seek. He studied HIV positive patients, or individuals who were told that they were HIV positive. And what he found was those folks actually wanted to increase uncertainty. Uncertainty for them was hope. They wanted to kind of challenge this diagnosis. They wanted to get a second or third opinion that said, well, maybe it's not HIV, right? That increases uncertainty about their illness, increases uncertainty potentially also about the likelihood of their survival. This was the research that he did early on was in the 90s when HIV was a death sentence. And so there's other contexts in which he also studied in which, yeah, uncertainty is actually something people seek. So it's not always the case that uncertainty is stress producing, but the work that we're doing focuses on that. And it's really discusses threat-related uncertainty. And that's really where in the domain that we're going to be looking at today. All right, so what is uncertainty? What are some other aspects of uncertainty that I wanted to highlight? One is there's some fascinating work that's being done looking at the neurological correlates of uncertainty. So in other words, people have created uncertainty, have done experimental designs where they've made people more uncertain or less uncertain about certain things, and examined the neurological functioning and the neurological correlates that come with those uncertainties. That's very much a growing area. It's been studied for the last at least 10 years, but we're still nowhere near where we need to be there. But what they have established is that there's absolutely a neurological connection to our experience of uncertainty. And one of my interests is, just as we know that chronic stress can produce actual changes to our neurological paths and to our neurological functioning, I would expect that chronic uncertainty does the same. And my interest is, if that's the case, and we don't know that if that's the case yet or not, then we would expect that to influence a whole range of behaviors, decisions, emotional states, etc. So to our brain is actually quite important. Uncertainty is also multiplicative. What does that mean? It means that if I become uncertain about something, if suddenly I become uncertain about my health, then there's a whole range of other things that I'm suddenly going to be uncertain about. I might become uncertain about my finances. I might be uncertain about my job. I might be uncertain about my ability to be a good father. I might, right? So we get one uncertainty suddenly produces multiple uncertainties, and we're having to manage all of them simultaneously. We know that uncertainty is shaped by culture. There's not nearly enough about this, unfortunately, but we know that in fact it is. And some of the work, in fact, has shown that cultures differ in their approach on uncertainty. If you think about language, even, I'm sort of mixed identity. So I'm Palestinian, my dad's Palestinian, my mom was American, and I grew up in Beirut, so I know Arabic. And in Arabic, one of the things that we'd say routinely is inshallah. It's a sort of a throwaway word that we say at the end of almost anything. Technically, it's translated as God willing, but it doesn't carry a religious connotation. It carries more of a sense of a lack of control over our future. And so you'd say something like, I'll see you tomorrow, inshallah, right? Even that idea is brings uncertainty to our day-to-day language in ways that other languages, other cultures don't. But it, of course, goes far beyond that. Different communities have different experiences with uncertainty historically, and so manage it differently, think about it differently, seek more or less of it, etc. So we need to know a lot more about the way it's shaped by culture. I've highlighted in yellow this idea about linked control, because we're going to come back to that later, but that's a key element that a lot of research on uncertainty has shown, that the less control you feel you have over something, and if you're unable to predict it because you don't have that control of it, if you're unable to control the outcome because, again, you don't feel like you don't control it, so therefore you don't feel like you can predict it, etc., then that's also going to be strongly linked to how you process uncertainty, how much you experience uncertainty. And so we're going to come back to that. We know that there's individual predispositions, there's personalities that deal with uncertainty different than other personalities. So we each differ a little bit on how comfortable we are with uncertainty. In fact, there's at least 10 different personality styles that have been studied that are associated with differences in how people manage uncertainty or process uncertainty or are comfortable with uncertainty, etc. And the last thing I wanted to talk about on this page is a little bit about the idea of difference between episodic and chronic. Most of what we know in uncertainty is episodes. There'll be an event, and that creates uncertainty, and then we're trying to process that uncertainty or manage that uncertainty, etc. It could be a relationship event, it could be a world event, it could be a health event, but it's an event. What we talk about quite a bit in the press, and what we hear a lot about, especially now under COVID, but long before that in other contexts, is an idea of chronic uncertainty. There are communities, there are people who are always living under uncertainty. There's work and health illness uncertainty that has been around for quite a while and is very important in the medical field, where people have chronic illnesses and they're living day to day with uncertainty tied to that chronic illness. But I'm thinking more broadly than that. I'm thinking about community-wide experiences of chronic uncertainty. Immigrants, certainly COVID now is a good example of communities in the entire world managing uncertainty in a chronic fashion. And so I wanted to separate a little bit on episodic and chronic, only to kind of be able to distinguish between those two types for us. All right, so I want to speak briefly about, if I go back, remember I was talking about the individual predispositions. Here's the most common example, one of the most common personality types, called intolerance of uncertainty. Michel Dugas is one of the folks who was really central in testing it specifically and developing it specifically in the context of generalized anxiety disorder. This is a great sort of quote of his. If you're allergic to nuts and you have a piece of birthday cake that has a drop of almonds in it, you have a violent physical reaction to it. A small amount of a substance that's not harmful to most people provokes violent reactions in you. So intolerance to uncertainty is like a psychological allergy, right? So people who are intolerant of uncertainty react to uncertainty violently. They really, really are uncomfortable with uncertainty. And that leads to a range of different approaches to uncertainty. They might avoid uncertainty in all kinds of ways. If they can't avoid it, then they're going to react in very problematic, difficult ways. And so that's one way that we can think about uncertainty, how much we do or don't tolerate uncertainty. And if you're interested in this, there's some really interesting measures, both for the lay public on the web, or also in the research on this question. You can test yourself on where you land there. It's been linked to a lot of important outcomes. What I've been trying to think about is a little differently, is this idea of what are the contexts of uncertainty. And other folks, Dale Brashears is one of them, who was looking at this generally at the individual level, and specifically in the context of health. But the way I've been moving is trying to better understand first of all, micro to macro, uncertainty about the self, uncertainty about the other, and also uncertainty about one's country, or where they're residing, their country of origin, or where they're residing. And then 4 general categories. So it could be uncertainty about health, broadly speaking. So uncertainty about your own health, uncertainty about a partner's health or your parents' health, or uncertainty could be, especially in COVID, is one of those things that really made me aware of this example. You could think of health at the very macro level of health, like individuals' health across the country. How much is the country a risky place for health? How much can I predict the overall population's health in terms of the country dimension? Safety and security is a very common example of uncertainty. Do we feel safe? Do we think that our family is safe? Our children are safe, our relatives are safe, and do we think that the country as a whole is safe? And we could think of safe from attack, or we could think of, more broadly speaking, in terms of safe as a violent country from guns, for example, in the United States it could be a common example. In the Palestinian context, certainly it's not there's a lack of safety at the general. So is Gaza safe from from attack? And certainly the answer to that is no. So that's the kind of example you might think about related to uncertainty. How much can I predict that a country is safe, is not safe, or there's some uncertainty there in the middle? Finances is another. Again, your own finances, family's finances, a country's overall well-being financially. and relationship. How, do I feel confident in my marriage? Do I feel confident in the relationship between myself and my friend or my daughters? And what about others? What about my parents' relationship, etc.? So these are ways we can think about uncertainty and ways in which we're affected by that. All this makes us think about vulnerable communities for uncertainty, and we could speak about that. I'm going to just kind of skip, sort of go quickly around here, some bullet points. We know that low SES socioeconomic status communities are going to be much more vulnerable to uncertainties and chronic uncertainties and multiple uncertainties because so little is under their control. So little of the structures of society are there to give them predictability. Same thing you can say with lots of this, communities of color, communities on the margin. So we can think of disabled communities, we can think of illness communities, etc. Elderly, they're managing uncertainty about life, about health, about about lots of things that they're going through, lots of changes. Certainly, if you're a community that experiences high violence, your life is filled with uncertainty, and there's also been a lot of work on even domestic violence, family violence, and how that's tied to uncertainty experiences in the kids and how traumatic that is. And certainly displacement. You can think of refugees, undocumented immigrants, etc., as examples of communities that are undergoing and experiencing chronic uncertainty in ways that really affect their day-to-day lives. So what are some negative impacts? We've talked a lot about what type of uncertainties there are and what they are and who experiences them, but here's some examples of some potential negative impacts of having chronic uncertainty, right? So we have allostatic overload. So for those of you who may not be familiar with that term, what I'd like to think is our body is, there's an allostasis, and so there's sort of a equilibrium of how our body is managing our stress often. And if we're experiencing, this comes from the chronic stress literature. If we're experiencing chronic stress, our body no longer is able to manage that stress adequately. And our body responds in ways that are not at all productive. And so I would expect the same thing would happen in chronic uncertainty, although again, many of these have not yet been tested. That leads to threats or creates threats to the immune system, so we become less healthy. We know quite a bit that uncertainty is in fact tied to generalized anxiety disorder. Sorry, I just noticed that typo there. We know less, but enough to be able to predict this, that emotion dysregulation, and for those of you who may not know that, often hopefully we're able to manage our emotions quite well, but sometimes events happen or we're under chronic experiences of stress that lead us to not be able to manage, we feel overloaded in our emotions. And that often is associated with really dysfunctional emotional expression and really overloaded emotional experience. High risk behavior, we might engage if we're experiencing chronic uncertainty. You can think of youth who really can't predict their future at all, don't know how long they're going to live, can't predict that. They might be much more likely to engage in high risk behavior, drugs, alcohol, just generally risky behavior, because they're not quite as concerned about the consequences if they can't predict their future. They don't feel confident about being able to predict their longevity, their future, than other communities. And related, at least, maybe some poor decision making that comes from this, because again, they may not think that the consequences are that severe if they don't even necessarily are confident that they're going to have how long they're going to live. There's also other potential impacts, as you can think of these more positive impacts, but again, these have not been tested. These are just conjectures based on some of the work that I've done, other people have done, and that I think might be the case. You might get communities under chronic uncertainty, and again, I say this because we actually don't know that much about chronic uncertainty communities. We talk about them a lot. We talk about uncertainty being a really common thing, but we actually don't have many systematic studies that look at chronic uncertainty communities. Communities under chronic uncertainty. And that's why I wish, we need to do a lot more work. But you might imagine a situation where people who are constantly under experiences of uncertainty are better able to manage episodic crises. When there's suddenly an episode that creates elevated uncertainty, they might actually be able to navigate that better because they're used to navigating experiences of uncertainty. Relatedly, they might have more developed coping mechanisms. They might have found ways so far to manage these things, and so they're more developed than people who aren't used to managing episodic uncertainty or uncertain general. They might have higher baselines of grit. Grit is one of my favorite sort of variables to try to understand human beings, but essentially it's just sort of strength, ability to over resilience in some way, but it's not quite the same as resilience. It's maybe more a notion of strength. And they might have a higher baselines of grit than communities that don't have chronic uncertainty. There is a possibility that because of what they've had to go through under chronic uncertainty, they've had, it's forced them to have more creativity in their responses. Maybe more community strength because they've had to come together more often to manage these things. And there may be more short-term focus rather than long-term focus, because if they can't predict the long term, maybe they start focusing on the short term, and that might actually come with some benefits. So although we think of uncertainty generally in negative terms, and we're going to mostly talk about that in the rest of the lecture as well, I hesitate to go down that path too quickly, because I actually do think there might be some communities that have to manage this chronically might actually have some real benefits counterintuitively, not sort of benefits to their hardships. I certainly don't want to say that, but that they've in their sort of management of challenge, they've evolved into being able to manage uncertainty type situations better than some other communities that haven't. All right, so that's the first sort of introduction. What is uncertainty? Give you a real overview, decades of work in short period. And now we're going to sort of pause a second and go into chapter 2 and focus on, okay, now that we know a little bit about uncertainty, let's think about COVID and uncertainty. We'll go through this a little slower in some way, just to kind of, because I wanted to make sure to cover a lot in a short period of time. So we just completed a study that collected data at 4 points in time. It was a Qualtrics sample, and it started on April 15th. The deaths there are the number of deaths on April 15th in the United States, just to give you a sense for where people's minds were at in terms of the progression of COVID in the United States. They were all married individuals. We were interested, one of the parts of the study was understanding the way in which marital partners essentially helped us make better or might help us make worse in terms of coping with uncertainty, but the role of marriages in management of stress and uncertainty. And so that was a requirement. So everyone in the study is married. And the total sample, meaning that completed all 4 phases, was 1,052. So it was 4 points across 2 months. As you'll see, and this was the April 15th plus 25,000, that was from 3 weeks earlier, 2 to 3 weeks earlier. I can specifically, it was 3 weeks earlier in that case. You'll see there's sort of a 2 to 3 week lag between each data collection point, and that was purposeful to try to get a sense for change in progress. The income distribution was higher than we would have liked. We've actually expected a Qualtrics sample to be lower in income, but just to be sure, we included several validity checks in our study, so we feel confident, and we eliminated folks who didn't pass those, so we feel confident in the validity of the data. But we have, out of those 1,052, 164 who had annual incomes of $50,000 or less, and you see those distributions there. So it was definitely a relatively high income group overall, but one of the reasons I put that up is because a lot of the analysis that we're going to be doing, that I'm going to be showing, is tied to income distribution. If we really had a low income group, I think we would have found even stronger effects. But unfortunately, while we did at the beginning, the first wave, we had a substantial, they were also among those to drop out over time more often, more so than some of the higher income groups. It's interesting in itself, but also understandable. So the first data, again, this is just a peek. This is a peek at some, we just are starting to look at these data. So just to kind of give you a sense. But here are some interesting data. So the white line are the low and mid, the lowest category. T1 is actually pre, so that's not, T1 is actually before the study. So at time 1, we asked them to think back to their experiences of uncertainty across several dimensions, like the dimensions I talked about above, before COVID hits. And then at time 1, which here is time 2. So time 1 should actually be pre, time 2 should be time 1, etc. So you're not confused there. But what you'll see is that the low income group, the low to middle income group, started higher and remained higher than everyone else. The trend is the same, but the middle and the mid-high and the high income groups never approached the low income groups. So we have low income groups that are starting with more chronic uncertainty, that when you have an experience like COVID hitting them is layered on top of that. And the concern was that they actually wouldn't recover. Now, I'm glad to see here that the trend is similar across the low to mid income group than the others, but you can definitely see that, in fact, even once COVID hit, the other income groups barely reached the level of uncertainty that the low SES and middle SES group was before COVID even began. And this is one place where, because it was just time one data, I took a look at the really low income group, I think we had a 10,000 or less, and then 20,000 or less. And not surprisingly, that group, if you separate that group out from the 50,000 or less, they're even higher on uncertainty. And in fact, they were high enough where the other groups never reached them in terms of post-COVID. So what we're dealing with here is an income effect that is quite strong, that low-income folks are dealing with uncertainty, not surprisingly, given what I just spoke about, but dealing with uncertainty in an ongoing way, which is quite troubling. So what? So what are the implications? We talked a little bit about some of the potential consequences of uncertainty. Here's some data tied to that. We used the mental health inventory, 5-item mental health inventory to measure mental health. And we relied on some cutoff points that have been published. One cutoff point, and I cited it below, gives sort of the most, in some ways, it's the most liberal. It's a relatively liberal definition of disorder. So it's starting to see symptoms that are troubling, and in fact, they're able to show that to be predictive of disorder. I use that only for the purposes of trying to get a sense for how that distributed across incomes. This does not, so these are percentages in these cases. So you'll see 65% of the low to mid-income group met that criteria for the beginning possibilities of mental disorder. And in a typical sample, it's about 40%, so 35 to 40%. So you can see the impact of that, but you can also see that the low-income group, time 1, time 2, time 3, so they were always higher, and the mid-high and the high are pretty similar. There's a big gap between the low, mid, and the others. So good news is that decreased across the 4 times. Bad news is that gap never really changed in those distributions. And we, even at time 4, we have the low-income group being higher than what is typical for, for typical samples here. Now, it's not surprising when we collected, in some ways, when we collected time 4, as you'll see back here, June 13th, there was 113,000 deaths in the United States. Now, of course, there are many more than that. But you do see here that the trend was going downwards from 36,000 increase between time 1 and time 2 to only quote unquote 20,000 between time 3 and time 4. So there was a better sense that over those 2 months, people I think were adjusting to the reality of COVID, which is probably why you're seeing lower rates of these symptoms of mental disorder. This is sort of the next so what is what's the impact of uncertainty. So this is really striking data. It's odds ratios for mental disorders. Again, the broad definition of mental disorders. And so what you'll see here is that for the low to mid-income group, for every increase in uncertainty, one unit increase in uncertainty, that people are 8.15 times at a greater risk of having a mental disorder than folks who are not higher on uncertainty. So uncertainty is playing a really, really important role here. Even with the mid-high and the high, you can see those effects. Again, you see a bigger impact on the low to mid-income. We go back to this pattern, where low-income folks are at a significant disadvantage and are harmed inequitably on this front. But you see even them, for all folks, uncertainty plays a big role. Now again, I want to caution here. We know that uncertainty and stress are correlated to some fashion. And I've started looking at, okay, well, when we remove the effect of stress, how much is left over for uncertainty to predict? So yes, we know that stress affects mental health to a certain degree, but what about just the lack of predictability, separate from its covariance and sort of relationship with stress? How much is left over to get associated with mental health? And the good news is that we definitely are finding that uncertainty absolutely explains and accounts for differences in mental health. I mean, the good news in terms of understanding uncertainty and its role, separate over and above stress. This analysis does not separate stress and mental health. So some portion of that undoubtedly is stress, the effect of stress on mental health. But nevertheless, it was a measure of uncertainty, and we can see it's quite strong. Shifting now before we go to the part 3 to, okay, we've seen that there are negative effects of uncertainty. Uncertainty plays a really negative effect on mental health, and therefore it's important. One of the things we're trying to understand is what are some things that we can do to buffer that negative effect of uncertainty. And one of the things that we're looking at in our research is a version of self-efficacy. And in this case specifically, we measured perceived influence. And the sort of question is, do you feel that you have the ability to get out of the negative effect that COVID is producing? Do you feel like you have the ability to change the negative effect that COVID is producing? Again, not surprising, but sad and unfortunate, and speaks to structures. The low to mid-income group feel significantly less able, having less influence than the mid-high or the high. And again, that's not entirely surprising. The good news here is this, and this you'll notice here, no difference at all across income categories. This is the odds ratios for a mental disorder, but you'll see if you look closely at the negative, sort of the negative statistics, the odds ratios, these aren't actual odds ratios, these are just, it's a graph to reflect the negative betas, but the odds ratios are basically 0.25. So with 1 being no effect, anything below 1 shows that it's affecting the process in the negative direction. So this is basically saying that there's about a 75% lower probability that that for each increase in perceived influence, people are less likely to reach that threshold for mental disorder. So we know that if we can give people a sense that they can have control over their future, to make change themselves in their future, that is going to benefit them. And if you look at the whole picture, if you look at uncertainty and the negative effects of uncertainty on the one hand, but then the buffering and more positive effects of perceived influence on another and efficacy on the other, you can start to see the kinds of things that maybe we should be doing to work with folks overall, especially in lower income communities. So that gives us a little sense about COVID, and I'd love to hear your questions and thoughts. Again, these are very preliminary data. I hesitated to put them up, but I wanted to at least share with you a little bit about those data. We're going to be doing much more sophisticated analyses as we get more time to look at those data more carefully. Okay, so on to now part 3. So we're going to be now discussing how do we manage these uncertainties. We've already said how the negative effects they have on people, the importance that of uncertainty in our experiences. How can we manage them? And one of the ways that I'm trying to bring together the literatures on this is through an acronym of CARE, and it coincides with the center. That this was not, this is by coincidence, but a positive happenstance. What I'm sort of laying out, and I look to test moving forward, is acronym CARE. So control what you can, advocate for who you can, including yourself, recognize your limitations, and elevate who you're with. And these are all coming from well-established literatures, not in the context of uncertainty per se, often in the context of stress, but that I think shows promise in our ability to understand how to manage uncertainty. Okay, so control. I'm going to talk briefly about each of these. This is something that there's actually been a good bit of editorializing on and some really interesting work done on this issue. The idea is if we're all going through lots of uncertainty during COVID, you have communities that are experiencing lots of uncertainty generally. Again, I think about refugees. I'm working in Gaza right now, some folks in Gaza, and again, their life is nothing but uncertainty. In fact, they talk to me about this is all they know is uncertainty. So there are communities, many communities like that, and they're certainly low-income communities are similar. I gave you examples of vulnerable communities. And so one of the things that there's some work on is sort of, first of all, separate what you can control from what you cannot control. And a lot of, if we think about COVID, a lot about COVID we cannot control, but some we can. And one of the things that I'm working on to test is sort of this ripple effect that I may not be able to control some very big parts of my life, but if I can control some small parts of my life, that might actually really bring benefits overall to the negative effects of uncertainty. It might ripple upwards to be able to affect the things that I can't control. So again, in conversations I've had with refugee communities, with Palestinians, things like going on a run every day at the same time, going on a walk, having dinner at the same time with the same people, having some sense of control over your own schedule to the extent possible, or finding ways in your life where you do have some control and taking that control has been shown in different contexts, and I'm quite hopeful this would be the case very much in affecting uncertainty to really help us in that realm. So control is one. Advocate. There's some really interesting research done by an Italian professor working with Palestinians, Guido Veronesi, where they're looking at, and his colleagues, many of them Palestinian working in Gaza and the West Bank, looking at activism and looking at essentially self-advocacy. So engaging in activities that make them feel that they have a sense of that they can shape their future when they really don't feel that at all. And some of the work that they've done are interventions that involve youth in activism, give them a sense of control when they previously didn't, and therefore help them manage their lives and their uncertainty, I'd argue, really effectively. So we can think about what are some things that we can imagine in communities that are vulnerable to chronic uncertainty, where we can really encourage advocacy activities and ways in which that might benefit them. Recognize the things that you can't control, and again, that I talked under control, the idea that we can control some and we cannot control others. And there's quite a bit here in terms of just recognizing what we can't control and letting go of it. There's some obviously work on mindfulness on this, and there's lots of different areas of research that talk to us about recognizing and letting go of areas that we can't control. For some communities, these are many areas that they can't control. And so the hope and the goal is that they're able to separate those things from maybe even what appears to be small, but potentially rippling effects of things that they can't control. And finally, elevate. And that's what we know, some tertiary related research that looks at the ways in which, how can we work in a sort of communal coping fashion with folks who need our help, communities that are really combating uncertainty, even if we're combating uncertainty, working with other folks, other communities who are either in our same shoes or even experiencing more uncertainty than we are. Not only does that help them feel like there are other people who are supporting them and help them. We know quite a bit of the benefits of social support for buffering the negative effects of uncertainty, and that sort of is part of the literature I'm using here. But it also helps us because, again, if you go back to the idea of advocate, you're feeling like you're doing something. You're controlling one element of your life, and in that element, you're giving, providing to others, which elevates to them. And so it works on, the idea of collective care is an important one. And if we're all elevating others, then we're all going to benefit. Both our own uncertainties are going to get, the negative effects of our own uncertainties are going to get buffered, as well as contributing to the buffering of the uncertainties of the folks we're working with. So that's the idea of Elevate here. And it could be helping your neighbor in COVID. Lots of people went to elderly neighbors or neighbors who were especially immunocompromised and got groceries for them, et cetera. That would be an example of what I mean in this case, et cetera. So finally, to conclude, one of the things that I want to be sort of clear about is this literature, especially the literature on managing uncertainty, but really most of the literature on uncertainty. But I'm going to focus right now I'm going to focus on the managing component. I think assumes a certain level of efficacy, frankly, or a certain level of ability that may not reflect the most vulnerable of the communities. So this idea that we can separate what we think about what we can control and what we can't. This idea that we have the energy and the resources to help others. And the idea that we have enough esteem to advocate for ourselves and to engage in activism. Those are all privileges that I recognize that many communities don't have. I think it's important, and so I recognize that the sort of that model that I provide may be more effective for some communities than others. But what I would argue is that it should hopefully allow us to think about how we can create conditions that allow thriving under uncertainty. What are policies that we need to push for that allow communities, individuals in communities, to advocate for themselves? What are policies that we can advocate for that elevate communities? What are policies that we can advocate for that allows people to be in allostasis and to be in a position where they can reflect on what they can control and what they can't? What are policies that we can push for that give people more control over their basic needs, over their basic future, over their goals, over their family's basic future? So if we come at issues, not only COVID, but more broadly, life in various communities, with a framework of this care framework that I'm laying out, that other, for the research on chronic uncertainty and what buffers it, there are many avenues in which we can reflect on what does that mean for activism? What does that mean for nonprofit work, for work in communities? What does that mean for how we advocate? How do we collaborate? How do we become co-conspirators with vulnerable communities that allows the space, the system, the structures for them to do, as I showed earlier, for them to be able to manage and process what the high and middle income groups can do. Now, this was just one analysis based on income. And as I said, it's a high income group. Imagine this analysis on other dimensions of vulnerability and then apply them in those contexts. So in ending, I wanted to not only introduce a little bit about what we know about uncertainty, but reflect on the reality that communities, structures in communities across the world make it so that some of our communities, some of our citizens, some of our people, citizens or not, are far more vulnerable to chronic uncertainty and their negative effects, have far fewer resources to be able to manage the uncertainties in the way that I have discussed than other communities. And it is our role, our duty as individuals, as human beings, certainly if you're out there and you're a scholar, it's our duty to think about the ways in which we can use this information, use this knowledge, understand uncertainty in the way it affects communities differentially to make change. So I hope that was useful. If you have any questions or comments, please go ahead and email me. I know the Facebook page is open to questions. I'll be checking that throughout. I really appreciate the time you've taken to listen and to take time out of your lives and to kind of to be part of this discussion, and I look forward to conversation. So thank you.